Bay Recovery is a specialized treatment center in San Diego on the Bay and beautiful scenery. Bay Recovery has a unique program blending chemical dependency, pain management, dual diagnosis, and sleep disorders. As healthcare providers, we all have come across individuals that are having difficulty with ongoing pain and psychiatric problems. This ongoing instability may continue regardless of the treatments and medications that we are utilizing.
I've had chronic pain for over 20 years. I spent a lot of time in bed. It's like I didn't have a life. I lost a lot of hope. And when I came to see Dr. Rand, I was a mess. A real mess, and I was in a lot of pain. And he listened to me, and I mean really listened, and believed that I knew what I needed, and I knew my body like the other doctors didn't. And he's really helped me a lot, and I have a lot less pain, a lot less, and I have a really good life now, and I'm very hopeful, and I have a lot more self-confidence, and I just love Dr. Rand.
At times it may be difficult to recognize that chemical dependency is an underlying problem. Not only do addictive behaviors occur, but the adverse effects of opiates and tranquilizers are frequently not recognized as a problem.
The reason I ended up here is I had a back injury that I ended up having 3 fusions on. And at first, coming out of the first and second surgery, I ended up being up on so much medication that I couldn't function at all. My entire life was in bed. I was flat on my back in bed. It was difficult to once a month to get up and go to a doctor's appointment. It was grueling. And then I was referred to Dr. Rand. It completely turned my life around. He put me on a program of medication and counseling, physical therapy, all in one building. All of them, this is like one-stop shopping. And as you can see, I'm here a different person.
Bay Recovery has a full pain program. We have a full pain management psychological track with written work and day-to-day groups that are highly effective, not only for chemical dependency, but are quite specific for pain in the chemically dependent patient.
I'm a former naval special operator. I did a lot of jumping out of buildings and airplanes and training very, very intensely. And it just caught up with me. I found out that I had a bulge on L5, L4 disc, and I had a laminectomy and discectomy. I was in more pain after the operation than I was prior to the operation. All the while, my quality of life was getting worse and worse, and I didn't get the clue that it was because I was so medicated. You know, I mean, we did everything from Cadian, morphine, OxyContin, fentanyl, you know, all on a rotating basis. And in addition to that, I needed psych meds because the pain was just sucking the serotonin out of my body. And so there was a whole cadre of psych meds and pain meds, which basically put me in a steady state of fog.
People on prescription medications frequently develop sleep abnormalities. Bay Recovery has a unique program of sleep management. Each patient is evaluated for a sleep disorder. Treatment at the homes are individualized and their sleep disorder is addressed. We utilize a variety of new technologies to restore sleep.
Sleep was pretty bad before, because I mean, it would hurt so much, but and then I would take the OxyContin or whatever I was taking, the fentanyl and all that stuff, and it would knock me out. I mean, I would just be out of it, like just. So I'd wake up a lot too from the pain and stuff like that, and end up, you know, taking more meds and stuff, and so I never did really sleep very good at all, more than an hour and a half at a time. You know, my sleep now is pretty good. I sleep, you know, 4 to 5 hours a night. You know, then I got to get up and move a little bit, Because like I said, my back is still it's pretty bad still, but then I can just fall back asleep again. Once I move and stretch, and I sleep again for another 4 hours. So I feel pretty good usually in the morning when I wake up. Sleep has improved tremendously. So
the goal of treatment in the pain and chemical dependency patient is to stabilize their medication use in such a fashion that there is no further need for abuse or misuse of medications, and they can return to their environment in a stable fashion and lead a normalized life.
Hello, my name is Brooke. I was the same Brooke from A&E Intervention. I've gotten my family back. My family and I are really close, got a good relationship. I'm going to AA and NA meetings at least twice a week. Been sober for over a year and a half. Due to the chronic pain that I started self-medicating myself, and I was, I thought I was getting close to having a relapse, so instead I made the choice to come back to Bay Recovery and stay in the sober living program. And so right now I'm in a sober living house and go to meetings and stuff like that, which I really enjoy.
Educating patients regarding their problem provides a foundation for ongoing stability in the future. At Bay Recovery, our goal is to restore normal physiological processing by treating both mind and body of the individuals that come to us, restoring function and a quality of life.